Drug addiction and overdose deaths have been steadily rising in Colorado before the COVID pandemic. And tonight, we're learning more about how the virus is setting a lot of people back in their road to recovery. Around $20 million slashed from substance use disorder and mental health treatment in Colorado because coronavirus funding has taken priority. News 5's Colette Bordelon has a story on what did and didn't make it through the legislature this year and what that means for folks living with addiction.
No one's really arguing with why the cuts needed to happen, but many are bracing for an increased need in recovery programs once the dust settles from the pandemic.
Hairbrushes, toothbrushes, toothpaste.
Judy Solano sees it firsthand.
So when I say cookers, people cook their drugs up in to inject.
At the Southern Colorado Harm Reduction Association in Pueblo.
Just trying to deal with it, and we're trying to offer people the services as best as we possibly can.
They've had to cut back on their hours because of COVID-19, now only open for 2 hours on Saturdays. But still, they see around 2/3 of the people they saw before the pandemic.
It goes to show that there has been no changes in people's activity and their ability to obtain the substances that they're using.
Concerning trends too. This year, El Paso County is on track to double the number of fentanyl-related deaths when compared to last year. And at the same time, around $20 million cut from the State Department responsible for mental health and substance use treatment.
Things were dire, and we had a lot of really tough decisions to make.
Representative Bree Buenteo says cuts had to be made.
Unfortunately, I think we will see a very drastic spike in opioid addiction.
The community behavioral health budget last year was around $213 million, with about 80 of that going to substance use disorder treatment. But this year, those programs will get just over $70 million. The gaps in funding filled with federal money, like a substance abuse prevention block grant and the CARES Act.
The federal government is continuing to invest a pretty substantial amount of funding into opiate treatment.
Camille Harding is the division director for community behavioral health and says the biggest cuts were on mostly new programs that had not been enacted yet.
Looking down the road, we need to continue to keep an eye out for how we're expanding services in rural communities.
And while some new national data points to the pandemic impacting addiction.
And I've been asking our data experts, what are we seeing right now? And it really is too early to tell.
The Colorado Consortium for Prescription Drug Abuse and Prevention hopes to see the initial numbers within the next 6 months.
When it comes to addiction, issues such as isolation, the stress of losing a job, we just know that psychologically this is going to put people at greater risk. Also
worth noting, in a blog from the consortium, they look at what it means when addiction bars someone from joining the workforce. For example, from 1999 to 2015, Colorado lost $21 billion in real economic output that we could have made because opioids drew over 27,000 people out of the workforce. And in a time of record unemployment, coupled with substance use struggles, this pandemic may only exacerbate that loss.
Just because COVID-19 hit the United States does not mean our opioid problem magically went away. We're just not talking about it.
But Buenteo did manage to get 2 of her bills passed, one making insurance cover treatment for substance use disorders, and the other helping treat pregnant women struggling with addiction.
Addiction is a disease, and it's time we start treating it like such.
As the pandemic adds to the problems surrounding it. I have a more detailed look at what programs exactly saw those budget cuts for you on KOAA.com. And coming up at 10, a story of hope and how the pandemic may have actually helped shake some stigma surrounding reaching out for help. Always watching out for you, Southern Colorado. Colette Bordelon, News 5.